Amit, your student nurse for today, and I am going to show you the return demonstration for the physical examination of the comprehensive geriatric assessment. So assuming that I'm done performing hand hygiene to prevent the spread of microorganisms and putting on PPE based on transmission precautions, next is to identify the patient. So excuse me ma'am, can you state your name and your birthday?
Kim Abigail, April 13, 2000.
Okay, so next is closing the curtains, assuming that I'm closing the curtains to ensure the patient's privacy. Okay, so now I am going to assess for your physical examination for comprehensive geriatric assessment. I'm going to assess the skin by inspecting it. Okay, so for your skin color, it is light to deep brown. It is uniform and no lesions. You have flat nose on your neck. No abrasions. Okay, so no birthmarks, and it is well moisturized. So, ma'am, can I pinch your skin to test for the skin turgor? Okay. Okay, so as I pinch back your skin, it brings back to its previous state. I'm going to assess the nails by inspecting it. Okay. So for your nails, it is smooth in texture, convex curvature, angle between nail and nail bed, and it is highly vascular and pink. Assess the head. First is the hair. Okay, so it is resilient hair, evenly distributed, no infection or infestation. So it is a thick hair. To assess the skull and face by inspecting and palpating. Okay, so for your head, it is rounded, normocephalic, asymmetric, absence of masses and nodules. So can you take off your mask, ma'am? Okay, so your face, for symmetric facial movement, it is normal and good. Okay, to assess the eye, structure and visual acuity. So first, okay, so your eyebrows, the hair are evenly distributed. So, okay, so can you blink for me, ma'am? Okay, so your lids close to symmetrical. So for the lining of your lids, it is smooth, shiny, and pinkish. So for your cornea, it is transparent, smooth, and shiny, and the details of the iris are visible. And your pupils are black in color, and it is round and flat. Okay, so next is, let me use this pen light to know your pupil reaction to light. Okay. Okay, so it is symmetrical and it is normal. Next is, please follow the movement of the object that I am holding. Okay, so your pupil constricts when looking at near objects, and it is dilated when looking at far objects, and it converges when the object is moved towards the nose. I'm going to assess for the ears. Okay, so the color of your ears are the same as your facial skin, and it is mobile, firm, and tender. Okay, so as I stand right here, I have to say a word and you have to repeat it. Okay, banana.
Banana.
I'm going to whisper some words and you have to repeat it. I'm going to assess for the nose. Okay, so for your nose, it is symmetrical and straight, and no signs of any discharges or any flaring of the nose. Okay, so can you cover the other side of your nose, ma'am? Then take a deep breath. Okay, then the other side of your nose. A deep breath. Okay. Okay, so as you take a deep breath, did you feel any resistance while breathing? Okay. Assess for the mouth and oropharynx. Okay, so I am wearing gloves to avoid contamination. Okay, so for your lips, it is pinkish in color. So can you open your mouth, ma'am? Okay, so your tongue is in a central position. And can you move your tongue, please, from side to side? Okay, so it moves freely. So it means that it is normal. So for your buccal mucosa, it is pinkish in color. Then your gums is in a pinkish color. Your teeth and white enamel, shiny. It is shiny. And for your oropharynx and tonsils, so can you open your mouth, ma'am, please? Okay, so there is pinkish and smooth walls for the oropharynx and tonsils. To assess for the neck. Okay, so for your neck muscle, okay, so it is equal in size and it is in head centered. Okay, ma'am, so can you move your head to the right and to your left, then upward, then downward. Okay, so you coordinated smooth movements with no discomfort, am I right? To palpate the thyroid gland for any smoothness. Okay, lobes are not palpated, so it means that it is normal. Let's assess for the thorax and lungs. Okay, so first, the shape symmetry of the thorax from posterior and lateral views. Okay, so it is symmetrical in chest. Next is palpate the posterior thorax. Okay, so there is no sign of any abnormalities. Next is palpate the posterior chest for any respiratory excursion. Okay, so can you take a deep breath, ma'am? Okay. As the client take a deep breath, my thumb move apart in equal distance. So therefore, it is normal. Auscultate your anterior thorax for any signs of breathing pattern. So I'm going to use the stethoscope. Okay, ma'am, please take a deep breath. Another one. Okay, so there is no sign of any abnormalities. I'm going to assess for the abdomen. So assuming that the patient is undressed. So inspect the abdomen for skin integrity. So unblemished skin, uniform in color. It is flat and rounded concave. So next is we have to auscultate the abdomen for any vowel sounds. So let's use this stethoscope. Okay, so it is audible vowel sound, so it means that it is normal. Next is we have to palpate the liver. So it is not palpable, it means that it is normal. Let's assess for the musculoskeletal. So for the muscle, it is equal in size in both sides of the body. Then palpate the joints for any tenderness. So as I palpate the joints, there is no tenderness and swelling, and there is no edema present while palpating the joints. Okay, so that would be all. Thank you so much for cooperating for this physical assessment, ma'am.